Okay, today we're going to be doing an assessment of the chest and the lungs. First, we're going to start with a recollection of your past medical history, and then we're going to move on to a physical examination. Do you have any history of a cough or any sputum production?
No.
Any associated symptoms such as shortness of breath, chest pain, or chest tightness?
No.
Any complaints of difficulty breathing, fever, or nasal congestion?
No.
Any noisy respirations or hoarseness?
No.
Any gagging?
No.
Any history of thoracic, nasal, or pharyngeal trauma or surgery?
No.
Any head or neck trauma, such as a motor vehicle accident or any type of surgery?
No.
Hospitalization for any pulmonary disorders?
No.
Do you use oxygen at home?
No.
Do you use any type of ventilation-assisted device, such as CPAP or BiPAP?
No.
Any snoring?
No.
Waking up at night?
No.
Any trouble sleeping or feeling tired throughout the day?
No.
Any chronic pulmonary diseases such as tuberculosis or bronchitis?
No.
Have you ever been checked for tuberculosis?
Yes.
Was that negative?
Yes.
Any history of emphysema, bronchiectasis, asthma, or cystic fibrosis?
No.
Any history of allergy testing for seasonal allergies?
No.
Any allergies affecting your breathing,
No.
congestion, or nasal drainage?
No.
An employment history?
I drive a truck?
Any exposure to environmental hazards?
Yes, occasionally.
Any exposure to chemicals, inhalants, vapors, dust?
Dust?
Any exposure to animal or pet dander?
Yes.
Any pulmonary irritants such as asbestos?
No.
You have exposure to animal dander. You have 2 pets, is that correct?
Yes. 2 dogs.
Okay. Did that irritate your breathing at all?
No.
Do you use any type of personal protective equipment at work to reduce your exposure?
No.
Does your work provide any type of equipment for you to utilize?
Yes.
Any home environment allergens?
No.
You live out in a rural area, so you don't have any direct exposure to cars or trucks or factory irritants?
No.
Any possible allergens in your home, like mold or anything?
No.
Type of heating?
Hot water baseboard?
Do you use air conditioning units?
Yes.
You
Central
have
air?
central. Any humidifiers or ventilation issues?
No.
Is your home equipped with a working smoke detector?
Yes.
Do you have carbon monoxide detectors?
Yes.
And how many of those do you have for both?
4.
4 each? And they're currently working and you check them?
Yes.
And do you currently use any type of tobacco?
No.
Did you ever have a history of smoking?
Yes.
And you smoke cigarettes?
Yes.
And for how many years?
30 years.
What age did you start?
11.
And you smoked for about 30 years. And about how many cigarettes or packs did you smoke a day?
A pack and a half a day.
And did you have any exposure to secondhand smoke as a child?
Yes.
Do you currently have any exposure to secondhand smoke?
No.
Do you use any type of rescue inhalers or nebulizer treatments?
No.
Any history of wheezing, trouble breathing with exercise?
No.
And you're able to meet your activities of everyday living without any shortness of breath?
Yes.
Any history of burns to your face or neck or any inhalation of smoke burns?
No.
Any difficulty swallowing?
No.
Any swallowing of any type of chemicals that would cause any scarring to your your airways?
No.
Any frequent coughing with drinking?
No.
Have you ever been diagnosed with aspiration?
No.
Have you ever been diagnosed with pneumonia?
No.
Any change in your diet, including thickened liquids or pureed foods?
No.
Okay. So that is a wrap-up of the past medical history. Next, we're going to move on to the physical exam. So I'm going to have you remove your shirt so we can inspect your chest and your lungs and your upper body. First, we're going to start off with inspection. We're going to note the shape and the symmetry of his chest. There's obvious symmetry on both sides. There's no obvious noted bulges or disfigurations to the chest. There's no scarring to the upper airway or the chest or the neck at all, or the face or the nose, it would show any obvious scar tissue buildup or anything like that. His nose looks like it's patent. He's able to breathe from his nose and his mouth. There's no noted obvious obstructions. The bony framework is obvious. You can tell the shape of his chest, the front and the back. You can see where his clavicles, the sternum, and the xiphoid process. He does look able to perform CPR, so he's not morbidly obese where he would not be able to have CPR or any life-saving measures. The sternum is rather flat and free of abundant overlying tissue. The anterior-posterior diameter of the chest is less than the lateral. The trachea is midline. It does not deviate to either side. He shows no obvious distress or any difficulty sitting there trying to breathe or swallow. Skin color is good. He has no noted cyanosis or any poor cyanosis or blanching or any scars. I'm going to take a look at his fingers. There's no noted clubbing or any cyanosis at his fingertips or any clubbing of his fingernails. There's no noted blanching. Skin color looks good. There's no obvious masses from his neck or his thyroid or anything like that would warrant for any concern of his blocking his upper airway. And then I'm going to have you just put your arms out. Anterior-posterior diameter looks good. No noted obvious masses or anything like that. There's good symmetry between both sides of his chest, equal raising of his arms. Okay, you can put your arms down. Next, we're going to observe his respiration. Observation for respirations. He's in no acute distress sitting here trying to breathe. Rate is about 16 a minute. Right now he's sitting here, but patient does state that he's able to meet his activities without any noted distress, respiratory distress. Effort is within normal limits, no noted distress, no use of accessory muscles. Chest movement is not shallow or deep. There's equal expansion, which is symmetrical on both sides of his chest. No noted audible breath sounds, no retracting or nasal flaring. He's able to use his nose and his mouth for breathing. There's no obstructions. Pattern is good. There's no accessory muscle use up here or any retractions down there. No JVD, which would show obvious long-term effects of hypoxia or struggling to breathe. There's no noted superficial venous patterns. Breath smells fine. There's no noted odor or anything like that that would warrant any possible infection. And next we're going to move on to the trachea is midline. There's no noted suprasternal notch, an angle of Lewis, costal angle, and the xiphoid process and the sternum. There's no noted abnormalities of kyphosis or lordosis, scoliosis, clubbing of the fingers, venous patterns, and can you just turn a little bit? We're going to take a look at his spine, make sure there's no scoliosis or lordosis. Spine is midline, good posture. Patient's able to sit straight up, no slouching over or advanced age that would inhibit him or make it harder for him to breathe mechanically. Such as arthritis or weakness where people would be leaning over more and that would make it difficult for them to get an adequate expansion of their chest. Okay, go ahead and put that over. Next we're going to